Good morning, everybody. The Subcommittee on Children and Families will now come to order and I'm pleased to be able to convene this hearing. It is the third in a series of hearings that we are holding on early childhood development with the hope that we could reauthorize the Child Development Block Grant, something that has not been reauthorized since the 1990s. At our first hearing, this is the third hearing we're having. On the first one, we focused on the federal return on investment and what it means and what are the benefits to society as well as to the child in early childhood. The second one was to focus on how to improve the health, safety, and quality of these CCDBG programs. And third, on the final hearing, we're going to focus on how we can improve child care without sacrificing the access to the program. With only so many dollars, where do we spend our money to really improve the quality of child care programs and at the same time not shrink the number that we have? In our previous hearings, witnesses often mentioned the tension between access and quality. If we invest in one, sometimes they say we end up at the expense of the other. Well, I think we need to rethink how we talk about it and what we do about it. We need to look at how we can encourage states to ensure that all CCDBG providers have some measures of quality, some concrete, specific measures. That way, when you invest in access and expand child care slots, you're also ensuring quality. This subcommittee is working on a bipartisan basis, and I'm going to thank Senator Burr and his very professional staff for their collegiality and the way we've really looked at the issues from the standpoint of our children, our families, and their budget and our budget, both of which are having some tight times. We're in this tough fiscal climate, and we don't want to push families out of child care. So we're going to ask our witnesses to give their time to give us recommendations with those two factors in mind. Child care is something that all parents care about. Parents want child care that is safe, affordable, and high quality. At the federal level, we often expect far too little. Sometimes we have no expectation that child care workers have pre-service training. There's no expectation that the facilities have regular inspections or those who work in them have background checks. Remember, we're talking about protecting vulnerable populations, often infants and toddlers who can't speak for themselves, and we must speak up in order to first protect them in that environment, and second, that they have a shot at early learning opportunities. We want to promote healthy development both cognitively, emotionally, and physically. CCDBG has not been reauthorized since 1996. The law often reflects old thinking that child care is primarily a work support program. Yes, that's one of the anchors. People turn to child care because they work. But at the same time, it is an opportunity to help kids get learning ready, or they're already learning. We need to be ready for the kids. We know that 80% of the brain development occurs before age 3 and 90% before age 5. More than half of the children that benefit from this block grant are from infants to up to 5, meaning that they're in these facilities at the time when their learning ability is growing the most at the fastest. So we need to use this not as a problem to be solved, but as an opportunity to grasp and to nurture. That's why Senator Byrd and I have been working with members of the subcommittee, particularly Senators Harkin and Enzi, to reauthorize the program and to involve all members, who have been very active, who are here now, Senators Franken and Bingaman, and I'm going to note Senator Bob Casey, one of the leading advocates. These three men and others on the other side of the aisle have been active in it. We want to increase participation. We want to promote better administration of the program. We want to ensure program integrity and accountability. But most of all, we want to improve the quality and coordination of this program. We don't have much time left in this Congress, but we hope we can find general agreement on this. And with members working on both sides of the bill, we hope that we can come to the ability to have a framework for reauthorization, take it to the committee, and take it to the Senate. It's one of these bills that I would hope would pass with unanimous consent. But I'm a dreamer, but I think dreams come true. So having said that, I'd like to turn to Senator Burr, who's been so active in this and has brought so many good ideas to the table. And this is the characteristic here. We focus with collegiality, with civility, and presuming that we both have great ideas and working with everybody that we can get the job done. I also want to particularly note his very strong advocacy for protecting vulnerable populations, both here, the census program, and so on. So, Senator Burr.